Hello, everyone. This is Gary Dolgin, candidate for Hillsborough County Circuit Court Judge, and we are here with Dr. Cynthia Woodwhite, a pediatrician here in Tampa. Dr. Woodwhite graduated from the University of Central Florida with a degree in aerospace engineering. And then she graduated from medical school at the University of Florida, where I went to law school, so go Gators. And then did her residency in pediatrics at the University of South Florida. She has been board certified with the American Board of Pediatrics since 2001, and she's peer selected for the best doctors in America. I have to ask you about the aerospace engineering. Is that a common major for future doctors?
Probably not the most common. Had a slightly different avenue that I went into medicine with.
Got it. So what got you interested in aerospace engineering?
I actually wanted to be an astronaut when I was younger.
Got it. I was wondering about that. Well, it's wonderful to be here with you this morning. Thank you for taking the time. What I always like to ask people when I'm talking with them, how are you and your family doing personally during these unprecedented times?
We're actually doing very well. So nobody's gotten ill, and we are, with the jobs that we have, everybody's allowed to work. The big change is, the school, the e-learning with school. It's a little interesting.
Yes. So what can you tell us? How is your practice of pediatrics? And you're part of a large office of pediatricians. How many pediatricians are in your office?
There's approximately 50 total with our group. In my office, there's 7 providers. There's 6 physicians and 1 nurse practitioner.
Got it. And so how has your professional practice changed in the last 6 weeks?
It has changed a lot. We've had to change our schedule. It's in pediatrics, we take care of kids, from birth up through 21. So there's a huge gamut of ages through there. Lots of vaccines for the babies. So what we did in the very, very beginning was we changed our schedule so that we have our well visits in the morning so that we can get all the babies in that have to be vaccinated. And then we do our sick visits in the afternoon. The amount of kids that we're seeing has drastically gone down. Part of it just from not as much illness going around because people aren't in school, so they're not sharing their germs like they usually are. So we have shortened our hours in the afternoon, and right now our last patient's at 3 instead of closer to 5.
Have you had any babies or any of your patients get the coronavirus?
We have, in our office, we have had a couple of patients where their whole family has had it. The one family that I had, the dad was traveling and he got it, and mom, and then the kids, but the kids they were younger toddlers, they just got minor colds. Mom and dad took the brunt of it. So
in that type of situation, like are mom and dad having to isolate themselves in separate rooms in the house, and they have young kids, what do they do?
Unfortunately for this particular family, they didn't know that dad had it until he had been home for a little while. So they all were exposed from dad at the same exact time. But ideally, if just one person has it, that's exactly what you do, is you isolate that person to a separate area of the house and kind of keep them in that area to try to keep the germs away from mom and the kids. It's extremely hard.
We hear that most of the victims who die are elderly people, but tell me about the risks for kids and infants as far as what parents should know about the dangers of this virus.
So far, even with infants, they've actually there's not a ton of infants that have tested positive, but in the studies just from all over the world, even the infants have done pretty well. The problem is for the first 2 months of life, babies just don't have an immune system just yet. So for the moms that test positive around the time of delivery, they're actually isolating the poor new mom from the baby until she clears the infection.
So, what should parents be looking out for? Obviously, especially with babies who can't communicate, what precautions should parents be taking, and what should they be looking out for?
For the very young babies, if anybody, especially because there are some parents that are still working, if anybody starts feeling ill and you have an extremely young child at home, especially under 2 months, you always want to isolate yourself until you know exactly what's causing the infection. For the older kids, they are probably going to be a source of bringing the infection into the house, only because for kids, one of the nicer things, if you can say that for the kids, is that unlike the flu, where kids will take a brunt and the mortality rate of kids under 5 with the flu is just as high as for people over 65. With the COVID, it's not like that. The mortality rate's much, much lower in children. There are still cases where some kids, just like a 20-year-old or 30-year-old, you can have some cases where kids and young adults don't have the underlying diseases, and there are still deaths. It's just a lot lower.
Even though we've been dealing with this for the past 6 weeks, there's probably still a lot of questions that lay people have. What's the difference between the flu that we've been dealing with for years and the coronavirus?
They're both viruses. The coronavirus, that family of viruses themselves have been around for a very long time. Typically, they're going to produce more of your normal respiratory symptoms, plus or minus a fever. They're not usually as strong or virulent, as we like to say, as the flu virus. The flu virus, typically if you think of a cold, but like the worst cold you can think of, and you add on body aches and extreme tiredness where it's hard to get out of bed. And the other problem with the flu is that around that 3rd to 5th day when that virus peaks, a lot of people do have problems because they're so weak from the illness, and pneumonia is pretty common with the flu. If you want to take that a step further, that's kind of where you're hitting into this new version of the COVID, the new version of the coronavirus, our COVID-19. It kind of acts like the flu in that for people that are symptomatic, where you've got the bad respiratory symptoms. It does, for a lot of people, not for everyone, but for a lot of people, it does like to affect the lungs even more so than the flu does. And a lot of people will get fluid in their lungs. And that fluid, when you get fluid into any body area, whether it's your ears, like the young kids do when you get ear infections, you get fluid in your lungs, it's so much easier for pneumonia to develop.
Now, obviously, we don't have a vaccine yet for the coronavirus, but if you get the vaccine for the flu, does that help you at all? Do you know, with regard to the coronavirus in any way?
It won't, except if you can imagine, if you were suffering from the flu, it takes a while for your body to recover from the flu. So if you got COVID on top of the flu, then that would be even more detrimental. So in that respect, I could see it helping. Our flu vaccine last year in kids had about a 55% efficacy. So that's the other question I have with the vaccine is, what is the efficacy going to be like? But even 55% would not be a bad thing. The more people you can stop from getting the infection, then the less overwhelming it will be for hospitals and ICUs.
So we've been hearing a lot in the media about potential vaccines, and we're all obviously optimistic and want there to be one quickly, but can you give us a reality check as far as what your thoughts are as a medical professional about some of these potential vaccines out there? They're having a lot more progress than what is typically seen when you're making a new vaccine. Part of that is because when we did have the SARS vaccine, they were working on a vaccine for that version of coronavirus, but that version just was not quite as virulent and we're not having as many problems as they thought. But because of all of that technology, they started with a lot of groundwork already done, and a lot of this is getting fast-tracked. There's just more than just one company that's
going, I play basketball, that's doing a full court press. I mean, there's a lot of companies that are doing full court presses. So they're getting a lot more information. I'm sure companies are much more in the mode of sharing information just to try to help everyone, because this is more of, instead of just one company that wants to have a monopoly, I think everybody would like to help so that we can get a vaccine out as quickly as possible. Normally, I would say a fast tracking of a vaccine would probably take about 18 months. They're working on, doing it a lot shorter, maybe even a year. I don't know how feasible that is, because this is going to be the first time a lot of these things are done, but I know their goal is to even beat the 18-month mark.
I don't, I'm a student of history. I'm just curious, because going back to the influenza vaccine, do you know how long it took to come up with that vaccine, and when we started, when it started being used?
I actually don't know that offhand.
Okay.
I definitely suspect they started working on it after that 1918 pandemic that they had.
Okay, well, that's a stump history question. I didn't know maybe if you might have learned that in medical school or not, but it is, sometimes it's kind of interesting to get a historical perspective.
Absolutely.
What advice would you give to parents right now as far as talking to your kids about what's going on right now? Sometimes kids get, a little scared about what's happening. What are you advising parents, and what are you talking when you're talking to kids in your office? What are you talking to them about?
The big thing is to be as open and honest as you can be with the kids, because not only do they know there's a lot of changes, all of a sudden mom and dad are at home and they're working from home and they're not allowed to go to their friends' houses and play, so they know there's a lot of changes going on and they don't exactly understand why. So, I mean, depending on their age group, of course, a 2-year-old a little bit different than an 8-year-old, but being just completely honest and letting them know, listen, there's a germ going around, and most kids know what the flu is at elementary school age. You could say it's kind of like the flu, but a little bit stronger. And I'd be honest and let them know, listen, if kids get it, they're doing very well. Mommy and daddy are here. We'll make sure you're okay. We're also doing this to help everybody else that lives in the world by staying at home and then giving people the social distance. We're just trying to help it so that it doesn't spread too quickly. And in the near future, we're going to be able to get back to the normal life. But we're just doing this right now just to help protect not just our family, but everybody's families.
Is there any difference in how the coronavirus spreads versus influenza?
It actually spreads, there's a lot of similarities, but it's kind of like how I was explaining, it's like taking it to the next level. With the flu, you're contagious for 24 hours before the onset of your symptoms, which is part of how the flu spreads so quickly, because people might wake up, wow, I'm a little tired today, but no fever, they just think they didn't sleep well. So the next day, like, oh, I have the flu. So everybody exposed that 24 hours before was exposed to the flu. So in that respect, the COVID-19 is similar, because you're contagious before, you're also contagious for, we don't know for sure exactly how long, but definitely we want people to stay while they've got a fever and until they're fever free for at least 24 hours before they go back out. But you can also go by your symptoms. If you've got a terrible cough, sure, you'd also want to not just have your fever gone, but you want a really bad cough, to improve before you go out and about, because it's definitely spread through respiratory germs. And then it can also be spread through other ways, but a lot of it, even from the medical side, we're learning.
If a parent is concerned that their child might have symptoms, can they be tested in your office now? Is there testing available in your office?
There is testing available. It's not as easy as far as our testing supplies as a strep swab. We have never run out of strep swabs. So there is still criteria. So the criteria has changed recently to it's not just fever, lower respiratory symptoms, and an exposure, because now we're not going to know exposures anymore. So the CDC changed that, and now it's, fever, but also things like flu-type symptoms. So if you reach the criteria right now, we unfortunately don't have a full supply. We have some tests. I think we have about 45 this week of tests. So if you reach the criteria, we're testing in the office. If you want to be tested, we do want to go through all the different criteria. If people still want to be tested, it's absolutely fine. They have opened it up nowadays. You just need to, we're just having those people test at either a testing center or at the lab.
So you're not actually giving the test in your office?
We do.
You do. So just out of curiosity, do you know approximately how many tests you've given out and how many have been positive?
As of a week and a half ago, and this would be between all of our office, we had done about 280 tests and we had 4 positive.
Wow. And what were the younger kids, or were they different, just random, or?
It was toddler to elementary were the ones that were positive, and those were known family contacts that were positive for the infection. So they weren't actually in our office, but it was definitely expected that the tests were going to be positive.
Because one of the parents had it.
Or grandparent that they had been around.
Wow. And is it typical? Do you see the common way of a parent getting, maybe they were traveling on business, or did most people get this because they were traveling?
At least in the beginning, absolutely. It was from people that were traveling around, whether car or plane. They were traveling to different areas where there were a lot more exposures. There are going to be a lot of people that are asymptomatic with the disease, so you can get it and maybe not even know that you had it, which is why eventually when they finish doing all the studies on the blood tests, that can be very helpful.
If someone's asymptomatic, how long, does that mean that they have antibodies that protect them from getting the virus again? And secondly, do we know why some people are asymptomatic and others get really sick from this?
Not for sure on the latter part. If you do have the disease, your body, as you recover from the infection, you'll make immunoglobulins to it. So that's what the blood tests are trying to look for, the immunoglobulins. The problem comes in, one of the ones that you make is called IgG. That stays around for a while, but the same thing with the flu. Each season, you know how they put different strains of the flu in because the flu can mutate. We don't know what COVID-19 is going to do. So you should be okay. And I have to say should, because again, we don't know how long your immunity is going to last. Again, it's a novel version of this virus, so there's still a lot that we don't know. Ideally, if you look at things in the past, at least during this time frame, you should be protected. And when I say this time frame, it might be 2 or 3 months, might be 6 months, but ideally you're protected for the immediate time from getting it again. As soon as the virus mutates or as soon as you lose that immunity, then you'll be susceptible to get it again.
Is that the same with influenza, that there's a lot of people that might have it, but they don't show any symptoms?
It could be. Like this past season, I'll have to say the kids with the flu, we had a fair amount of flu, but I had a lot of kids with just minor cold symptoms and not a high fever, like 101, but maybe their legs were more sore than the typical cold. So we were testing them, and a lot of kids still were positive for the flu. So it is kind of like that, in that sometimes when you get a virus, you might not have symptoms. Majority of the times you have some symptoms with the flu, but that's part of what we don't know about COVID, is how many are going to be completely asymptomatic versus mildly. Definitely the severe infections, sometimes it'll happen to an otherwise healthy people, but definitely people with chronic medical illnesses lung problems or elderly, they definitely have the highest risk of having more of a problem with the illness.
So, common family question. Let's say that you have a college student who's your oldest child and you have some younger kids, and your college student stayed on their campus during the past 6 weeks, and now they're coming home. Is it okay for them to come home and be under the same roof with the rest of the family?
Ideally, I didn't know of any college campuses that were still open, but ideally, if it was a college campus.
Well, I'll modify that by saying college campus was closed, but college student had their apartment there and they got a job and they wanted to stay. They wanted to stay there, and maybe they've changed their mind and they want to come home and be with mom and dad and their younger siblings now.
Okay, so if they were out and about and they were working in, let's say, especially they came from an area like New York, it came from a hot spot, your choice, you could not let them come home, but I would let them come home and just quarantine them for 2 weeks. Where you kind of treat them as if they had the illness and they're just in their room area. We'll deliver your food, we'll do everything just for 2 weeks. And if they don't have any symptoms after that, again, it's not 100%, but there's a good chance that they're not going to bring the germ home to you.
Got it. And there's been talk in the media that as we're approaching summer, that the virus will, I don't know, maybe go away or something. Is that accurate? Or is that just people's hopes getting up?
We're kind of, even though it's not, the influenza virus and the coronavirus are two different viruses, but looking at just the way most viruses are a lot more virulent, a lot stronger in the fall, winter, and up till about end of March, really for a lot of the viruses. So the thought is that if it follows the trends, that it will decrease. I wouldn't say 100% go away, but it would decrease over the summer months. But if you look at like the H1N1, we'll still see some flu cases over the summer, not nearly as many. And notoriously, it's in the H1N1 group where we'll still see that a little bit over the summer. But yeah, most viruses markedly go down during the summer. So that's the other problem, is to see what's going to happen in the fall. Are we going to see a peak? If it would go away permanently, that would be awesome. I don't think everybody's hoping for that, but I don't think anybody's planning on that.
So we've been told, probably the number one piece of advice that all of us have been told, and probably is washing our hands. And so washing your hands with warm water for 20 seconds. Now, if the water's cold, is it or lukewarm? Or is it better to be really hot, or what's the deal on that?
Definitely don't go really hot so that you burn your hands, because skin is your most important thing. Now, if you only had access to cold water and you wash with soap and cold water for 20 seconds, maybe it's not 100%, it's 99.5% effective. It's still very, very good, and I would do that as well. And then the big reason why you're washing your hands is not that the germs can make it through your hands. It's just that what do we do with our hands? We all touch our face. Our nose itches. As soon as you say don't touch your face, your nose is going to start itching. So the germs, majority of germs have to go through a mucosal surface, which is your eyes, your nose, or your mouth. So if your hands are clean, then it doesn't get to reach one of those mucosal surface, it should not be able to get inside of you.
Do you believe because we're all washing our hands more, or have you noticed, are people getting sick less in general because they're washing their hands more?
That will absolutely help a lot. That plus the fact that we're isolating a lot. Those are the two reasons why, if you look at the illness ratios right now, other than the COVID, most viruses have markedly decreased.
And so big issue, I guess, right now is kids are out of school right now. And the question is, when do they go back to school? As a pediatrician, what do you, how do we, at what point would you feel safe if you're asked about, telling parents whether their kids are safe to go to school? At what point are we safe? I mean, we're never going to get a total, nothing's risk-free, but what do you want to see before kids can safely go back to school?
That's going to be a really hard one because a lot of it's going to be a watch and learn or a trial and error. I hate to use the word error, but a lot of it's going to be kind of a trial and error. So having things open up over the summer, I think the timing on that works very well because, ideally it's going to have a lower counts and then people are going to be out and about. And then there's something called herd immunity, HERD, where some people might get it, might be mild. They're going to shed that virus and other people get it and it's extremely mild. Then you get protection from it. So that will be the goal until we get a vaccine. In an ideal world, if we could have a vaccine in July and school started in August, sure, that would be excellent, but it's not feasible. So I do know that the schools are going to be watching how the counts go over the summer. And even right now, I'm sure they're tentatively making different plans of what they could do because I know they want to open. And so what they could do.
We have overcrowded classrooms right now. Are we going to have to do double sessions? Are we going to have to do maybe some kids go on Monday and then they do learning at home on Tuesday? Or are those types of things that we're going to have to be looking at?
I have not heard anything from the school board yet, but I'm sure they're looking at all different kinds of options like that because it would not be feasible even with just 20 kids in a classroom. It's a small classroom and there's no room. They obviously couldn't be 6 feet apart if we needed to continue to do that in the fall. So I'm sure they're looking at things like split sessions or alternating days. I'm sure they're hoping that they don't have to do any of that, but I'm sure they're looking at that right now. But there aren't any definitive recommendations at this time, no.
I want to ask you about the wearing of a mask. If you had all of the kids wearing masks in their class, does that protect the kids? Let's say that you're not able to maintain that 6 feet social distancing. Are kids protected if they're all wearing a mask?
The short answer on that would be no. The masks are hard, especially with kids. You can't eat or drink, so they're going to have to take it off when they're drinking water. They're going to have to take it off. As soon as you touch the mask and you take it off, whatever germs are on the outside will now get on the kids' hands, all over their desk and everything else. We're also wearing cloth masks, which one of the big things it helps with is it keeps the kids from touching their nose and their mouth. So in that respect, it would certainly help them. Now, if they had direct exposure to COVID, the COVID can go right through that mask.
Would you be taking your child to the grocery store right now?
It's not, as far as we know, it's not like it's just going to jump out on you. So if you have a child that's, at least in this house, that's not 2 or 3 or 4 that touches everything, and they went to the grocery store and they didn't touch anything, but I think that's really hard. And none of the kids like going to the grocery store. So right now, because
well, if they get candy at the end, they do.
That's the only reason why there's candy. But ideally, I'm taking kids more for doing things outside, going for walks, going for bike rides, because that's your best shelter in the world is just being outside. Being in an enclosed area. There's a lot of single parents where you have to. So I would just go in, get out as quickly as you can. So some people it's not feasible and the kids would have to go, but I would bribe them, positive reinforcement, however you want to call it. But I would bribe them, if you don't touch anything, as soon as we get in the car, I'm giving you your cookie.
What about eating? The restaurants are opening and they're putting tables outside. Do you feel safe eating at a restaurant outside on the street?
So again, outside is excellent because you're just surrounded by the air, so you're not having as many problems. The only time you're going to have, or one of the issues you'd have to worry about is if a server was asymptomatic and had it, then sure, they could spread it. But I think that's why most of the servers are wearing masks, so they don't accidentally touch their nose before they bring you your plate out.
Would you recommend, as far as going back to school, that every child have their temperature taken as they're walking into school?
You certainly could do that, but you're not going to catch everybody with COVID, especially with kids. Because a lot of them they're not going to have fevers. They might not even have symptoms. So you will miss a lot.
Will you catch the majority though?
With children, probably not.
Got it.
If there was universal testing, we'd be able to say for sure, okay, look, only 10 to 15% of the kids that tested positive had a fever. So and we're getting to the point where we will eventually be able to do universal testing, but there's just not, they're still ramping up all of the test supplies. They're just not, every single person couldn't do one every day.
So I understand that you're concerned about vaccinations for other issues during this coronavirus situation. What do you want to tell parents about that concern?
It's not just in Florida. The American Academy of Pediatrics has been following, and the number of kids, and the major vaccines are done before the age of 2. The number of babies and young kids that are up to date on their vaccines has significantly dropped during this outbreak. And that's why we do just our well babies in the morning to keep them separate from everyone else. But even with that, there's a significant drop in the vaccine rate. So the hard part is, when just like the measles outbreak, if you have people that aren't vaccinated against Haemophilus influenza, against Prevnar, then as soon as you lose the herd immunity, if any of those germs come out, then you're going to have young kids. You're not just going to be worried about COVID, you're going to be worried about measles, you're going to be worried about Haemophilus influenza.
And this is a tough family-oriented question, but we have Mother's Day coming up this Sunday. We have young kids who haven't been able to hug their grandparents in 6 weeks. At what point would you feel comfortable saying that a young kid can hug their grandparent? Do we have to have a vaccine, or what? At some point, it gets to a situation where, at what point is something as important as family contact going to be safe again?
So as far as the grandparents go, and then it will of course differ from family to family. Like my dad's 82, so that's going to be different for a child whose grandparent is 66 and healthy. This has changed the way a lot of the social interaction is going to go. And are you ever going to be 100% safe of not transmitting it when a young child gives the grandparents a hug? Even with the vaccine, you're not going to be at 100%. So until the vaccine will help, after it's been around for a little while will help. But yeah, right now it's going to be hard, and we do the joking air hugs, so that he might be 6 feet away and you pretend like you're hugging and the kids laugh, and then even just a child's laugh can make not just a parent but a grandparent feel a lot better, and you sort of feel connected even if you don't have the physical aspect of touch. So this Mother's Day, honestly, I would respect more of the space, unless you have a very young, vibrant grandparent that wants I don't care. But for the most part, I would keep the space, especially for this Mother's Day. It's still very early in this pandemic.
And would you keep, if you're a grandparent, would you keep the grandchildren out of your home? Would you have the 6-foot contact outside, like if you were going to have a meal, eat outside, on the driveway or something?
If it's possible, that is the ideal situation. And especially if you have a little porch, any area, it's really beautiful outside in Florida. So we are lucky in that respect. It hasn't hit 100 degrees just yet. So yeah, if you can set something up like a brunch outdoors on a porch, or an early dinner outdoors, that would be your safest way. And that way you feel a lot more connected, because you can be much, the 6 feet outside just feels a lot closer.
And we've been talking about children in school, but we also have extracurricular activities for children. I mean, that's just such a part of normal everyday life. At what point, can we have Little League Baseball again, or soccer, or dance recitals, etc.? What are your thoughts on that?
We're definitely getting closer. So I would say, we've got the phase one, our version of the phase one going right now. And then as that goes well, we'll start into the phase two, where there's gonna be a lot more interaction, and just watching and see how the numbers go, especially right now, once we hit the phase two side. If you're, depending on what sport your child does, if you can get into a sport where there is some room, like tennis, or I guess these kids play pickle, I hadn't heard pickle before. Sports where they're not right on top of each other, they're not tackling, I would recommend starting with those sports first, and then give that some time. And if you're still doing well, then work in. And that's gonna be hard, because a lot of those summer sports and those summer tournaments, they start practicing right now. And I know there's a lot of lacrosse teams that are like, we need to know in 2 days if you're gonna play on this team or not. We need your money in 2 days. And that's really hard right now. I would be hard pressed to do a sport like that, sign up for a sport like that this summer. I would wait till next summer to do that one and try some sports with a little more distance to them.
Got it. Well, Dr. Woodwhite, thank you so much for taking time out of your busy schedule today to talk to us. We're going to have this interview posted on our Facebook pages, so that parents and can have the benefit of your advice and keep their children and their families safe. And we really appreciate you taking the time today.
Thank you for doing this. I think you're helping a lot of people.
All right. Well, great. Stay safe.
And thanks. You too.